Hello, guys, and welcome to yet another episode of VIPs in Action, Village Innovative Perinatal Support in Action, brought to you by Rose Breastfeeding here in Atlanta, as well as JMM Health Solutions. My name is Dr. Joanne Michelle Martin. I'm the founder of JMM Health Solutions, a pelvic floor therapist in the Atlanta metro area, and I am thrilled to be hosting this video series with all these amazing birth professionals. Today is by no means any exception. We've had such wonderful guests on our show, and today we have with us the lovely Jacqueline Lambert. Now, Jacqueline is a breastfeeding coordinator. She's currently working with Delta Health Alliance and is the lead facilitator of the Baby Cafe. She serves families in the community by advocating, supporting, promoting, and educating on breastfeeding. Additionally, she works with childcare partnerships and home visitation programs with educating staff on benefits of breastfeeding and how they can make their facilities breastfeeding friendly. She's been working with moms and babies for over 15 years and is a proud member of the NAPPLSC, the National Association of Professional Peer Supporters of Color in United States Breastfeeding Committee. She believes strongly that moms and babies need a personalized approach that is compassionate, unhurried, non-judgmental, and evidence-based. Families need support in order to make their own educated decisions on how to feed their babies with confidence and comfort. So without further ado, I mean, the bio speaks for itself. She's absolutely amazing. But without further ado, I would love to introduce you guys to our guest today, Miss Jacqueline Lambert. How are you doing today?
Hello, I am doing wonderful.
Awesome, awesome. Well, tell us a little bit more about you, where you're at, how you got into this line of work. The same. Most people say birth, anything in the birth professions is a calling. So, how were you? How did you feel called into this work?
You know what? I never thought about it like that, but it must be because before I started actually doing what I'm doing now, I started as a medical assistant working on the OB floor,
Mm.
but never was it stirred up in me until I went to WIC. So I've been working in WIC I worked with WIC for the last maybe 14, 13 years. And then I discovered in 2014 that I needed to do more. And of course, that was when I met Rose, Dr. Bug, and did a community breastfeeding training. And I thought, wow, I need to be doing more. I want to reach more than just the WIC moms. I want to reach my whole community. And so that training kind of like escalated or pushed me into what I'm doing now. And so I found my calling, I guess. And so working with the WIC moms has been an honor and a privilege. But being able to work in the community was like, this is where I need to be. So that's kind of like how we started. We started doing in 2015. After that meeting with Dr. Bug and Rose, and I decided I wanted to do more. I started hosting Let's Talk Baby sessions inside of the hospital on a Saturday. And so, because I wanted to reach more moms. And the hospital in the community was, allowed me to come in to do those classes. Well, I wanted to do more. So I started hosting Let's Talk Baby sessions with youth, with the teen moms in the school system in another county. Um, but I wanted to still kind of like be this resource for the community because it was not there. And I want, how can this happen? How can people know that it's more than WIC, but it's also being able to help our communities? So I just started strategizing and talking to people, but my name wasn't going over well. People didn't like Let's Talk support group. Support just for some reason in the Delta, that was just like a hurtful word. So I decided to, after talking with people, decided to use the baby cafe model. And that using that baby cafe model was like the stamp of approval for the community. Same thing, just different few words added. So it became Let's Talk Baby Cafe.
Wow.
It has been a privilege to be a resource in the community.
So, I mean, you mentioned the Delta. Where exactly are you located?
I'm located in Indianola, Mississippi. That's where the baby cafe is.
Wow. And I love the name Baby Cafe. It sounds chic and it kind of captures the younger moms, but it kind of piques the curiosity of moms that may have, been around the block a time or two, like, what is this about? I've not heard of a baby cafe. Let's do that, right? I like that. I like that a lot. So we've gone through the last several months now. This pandemic, it's been trying, it's been rough for a lot of people. How have you found that it has affected your community and also the services that you've been rendering to that community?
It was detrimental because we were meeting face to face. So we weekly we had an opportunity to sit, to talk, to share, and then all of a sudden we had to stop. Well, immediately I heard in my spirit, let's do Zoom. I didn't know much about Zoom. I wasn't familiar with things like that, but I searched it out, and of course going virtual has been the greatest thing for the cafe. We went from maybe 8 to 10 people a week to 20 to 50 people a week. And that amazed me because, but what happened, I not only had those moms, I had their family members, I had their significant others, I had their grandmothers, and everybody now was able to be a part of that care that could not be a part of it face to face.
Hmm. And isn't it
Yeah.
interesting? Because one of the things that when we talk about, moms and we talk about breastfeeding, one of the big issues is lack of support. And
Mhm.
oftentimes in a lot of communities, maybe because a mom or a grandmother or aunt or other family members are not familiar with breastfeeding, maybe they themselves didn't breastfeed. When a mom is encountering difficulty, they just say, well, go get some formula. Are you right? There's no guidance, there's no encouragement. And even if it were a situation where the baby needed to be supplemented, they still don't have all of the information where they can help guide because they themselves aren't aware. So I think that that's beautiful the way you've been able to bring, other family members and support people in to help make it better for moms. That's wonderful. And are you having a lot of people now outside of your local community as well coming into the baby cafe sessions?
Yes, that has been a highlight as well because before we were only able to reach moms in Indonesia. Well, it has opened up basically to the whole state of Mississippi. We have people from all across Mississippi joining in because we not only use it for our mothers, but it has become a training mechanism for other agencies as well. So that same platform is used to train agencies about breastfeeding as well as the moms and their families too. So um, COVID is bad, but we found a way to make it lighten the burden, if you can say.
Hmm. A lot of beautiful things are born out of adversity. And
Yeah,
I think that this is no different. It gave us an opportunity because more so because we were forced, right? We were made a little bit
right.
uncomfortable. And so now we're
Mhm.
forced to have to switch. And as this word has been the highlight word of 2020, is forced us to pivot somewhat,
Mhm.
and be able to kind of say, well, what can we do to still reach the people that we serve? So that's a beautiful thing. In addition to the baby cafe, have there been other things that you've been able to offer your community? Have you been able to reach more people with regards to the services that you offer or have wanted to offer?
Well, one of the things that we did, we partnered with or working in conjunction with the Bill Project in collaboration with the local hospital. And so one of the things that they wanted to do was create some type of resource so that the moms can have when they deliver that they can go home with. Well, needless to say, we were able to help publish wouldn't be the correct word, but we were able to create this resource guide that moms can have in a discharge bag because they're baby friendly and they're not doing the formula and all of that. And so we created this little booklet that they could not only read about how to get that help in the early days and also be able to make notes and things like that. So this has been work in progress, but it's done. And we were so excited about it because that pushed us to step outside of our comfort zone again, because this was we never done this. And taking input from what moms would like to see when they deliver, what would they like to have. And that was one of the things that the moms in the cafe discussed, that we would have loved to have a resource guide, something that we can look and read and be able to see pictures where we can actually follow through ourselves. So that is one thing. And then working with our home visitation programs and our child care facilities, implementing breastfeeding friendly practices in our buildings. And so that's something that we're working on now, actually trying to set up lactation rooms inside of our facilities, so that if a mom pre-adventure needs to, when we get back to going into buildings and things, that if there's a place that she needs to pump or needs to step in for a minute, then they definitely can visit one of the facilities and be able to do that.
Wow. How many facilities do you guys have around your region?
Uh, just I'm new to the agency for once, because I was with WIC for the last few years, and then I transitioned to this agency as a breastfeeding coordinator. So learning all about all the different programs, but I want to say there are about 11 child care facilities
Mhm.
and our home visitation buildings and things like that, just making it conducive not only for the families we serve, but for the women that work with us as well.
Yeah, that's a huge thing because there's, in a lot of businesses, there's not a place for women to be able to breastfeed. Many women report they'd have to go to their cars and pump, or go to a closet, or someplace that was not necessarily the most sanitary of locations, because it's not something that was typically taken into consideration prior, with maybe other staff members. What do I like what I'm hearing with regards to the collaboration with the hospital. And I think that that is huge. I don't know that, are there a lot of hospitals in your immediate area, or is just a local community hospital?
No, it's a local community hospital, and there's only one in
Hmm.
this particular town in Denolia. There are several small other communities around us that we are working with as well,
Hmm.
but this particular hospital is one of the delivering hospitals.
Gotcha. And I think that's a beautiful thing to be able to offer that service, and be a resource within the hospital. There are not a lot of hospitals that have those resources. And I think even with regards to COVID, because of their own, if they did have services available, their childbirth education, all these other things have been shut down. And I think being able to collaborate with the people who are already on the ground and doing the work in the communities is huge, because they're already in tune with the pulse of what the people want, what the women want. And they can help, the hospital and the medical facilities to be able to do, a better job of increasing education awareness and things like that. So I think that that's a remarkable thing that you guys have done. How has so you were a recipient of the grant from Rose. How has
Mhm.
this grant been able to help in assisting you to better serve your population?
It has really helped as far as with technology wise. Of course, when you first start out, you're using what you have.
Hmm.
And so it has helped me get the technology that I need to continue hosting these sessions, even when I'm not in the office, when I'm away, that I can still continue to have the sessions to meet with the moms, because even when we're not in the sessions, I meet with them one on one. And I still wanted, uh, technology or computers or tablets that was capable of doing that. So
Mm-hmm.
that has been one of the ups for me, as well as continuing with the subscriptions to Zoom as well, being able to increase those packages as needed.
Mm-hmm. Absolutely. It's amazing because you think, oh, I'm just going to be doing this thing over video. And then it's like, wait, I need this technology, right? Oh, wait, I got to do that too. Well, how do they schedule? Like, how do they do this? And now you have to kind of think of all these other different little things that you have to maybe have to have in place. Did you find that with a lot of your moms, as far as equipment goes, breastfeeding, do you often provide equipment for them as well along their breastfeeding journey, maybe pumps or shields or other pieces of equipment for them?
uh, I try to connect them with resources that can help them with that. For the most part, if it's something that I hadn't really got into the part where I'm getting pumps and things like that from other distributors, I would love to be able to do that, to have pumps on hand for moms who really need them, because that is a breakdown during COVID. Is moms may, there are moms who do decide to pump and just can't because they don't have it. And, with the guidelines and different things with other insurance companies and things like that, it caused them to quit on their journey as well. So
Hmm.
that's the project that I have in the back of my head that that I actually want to pursue, to actually have this equipment available for these moms
Hmm.
who really need them. I understand. I breastfed one child exclusively for 3 years, and one child I pumped for a whole year. So I understand for moms who say they just don't want to nurse, and just being able to meet that mom where she is, it
Hmm.
just means so much to me, without trying to change what she wants, but just standing right there where she is and being able to assist her along the way. So that's one of the things that I have in the back of my head.
Well, tell me what else you got in the back of your head, because so far these ideas are great. So, what other projects do you guys have in store? I mean, I think it's so wonderful to have this type of resource because oftentimes, like you said, a lot of times moms aren't met where they're at, and it's easy for them to quit. It's easy for them to give up. They don't have support, they don't have resources. It's frustrating. They don't have a place where they can ask questions. They don't have a cafe. They don't have all these things. So what other ideas do you have in store to kind of help reach the moms, not only in your immediate area but in the areas around, to help better serve them?
Well, one of the goals that I have, that I do want to make this available for all of our delivery hospitals, and I think maybe in my area it's probably about 3 or 4 more. And I would love for them to have, just for moms to have the resource when they go home. I also would love to have more businesses on board with breastfeeding. And that's not to say that they need to change everything, but just make it welcoming, that
Hmm.
a mom will feel that she have to leave, that just where if she has a right to be there, then so does she have a right to nurse her baby if she's there. Just those type of things, and trying to change the stigma of our society that kind of like still shuns on a mom nursing in public. And so those are things that I look to change in the near future. And I think it starts with me working with my own agencies and organizations, making little small steps with them, getting on board, and then saying, hey, we have this available in our facilities as well, and this is what we did. And,
Hmm.
just showing them that it's capable. I don't know if you ever been to Mississippi, and especially the Delta. Things just work a little different here.
I have never been down there. I have never been. And it's been a long, long time since I have been in or through Mississippi. Long, long time.
Yeah, so things work a little different here, and there's still a lot of little mindsets and things, but even meeting them where they are,
Hmm.
I think that has become a barrier for so long, that no one had the tenacity to step out to just say, hey, I can be a voice. And that's what, the different organizations, especially Rose, they so empower me that say, hey, you got a voice, you can use it.
Mhm.
And it stirred up some things in me to continue, even with educational wise, and making sure I had all the necessary things so that I can be better equipped to help the families in my community.
Mhm.
So
That's beautiful. That's beautiful. And we need that. We definitely need that. I think for a lot of moms, like you said, if there's nothing in the community, if there's nothing around, it's easy for them to quit, maybe not even start, right? And so we really need to have, and then the mindset surrounding breastfeeding. I remember reading something some time back where it said, how would you feel if somebody put a cover over your head when you were eating? And and it's funny, and it was said in jest, but I was like, well, most adults would be pissed. And they're expecting the babies to be okay. Why? But things like that. I come from a culture where people breastfed freely. I was raised outside of the country, and so for us it was normal. You walked around. I remember as a little girl, we would go places, and if a mom had to stop, maybe she was even at a bus stop and she was sitting on the bench to breastfeed her baby, or she was in a store and she sat down to feed her baby, no one said anything. Matter of fact, people would say, hey, you need anything, you need us to get you anything, you comfortable, people would say those types of things. And because it was just normal, nobody looked down on it. And so it was very interesting for me to see that difference in culture, where so many people are, they shun breastfeeding. They want to chastise women who breastfeed in public, things of that sort. And I'm like, adults are already, when they're hungry, they're hangry. Like they don't know how to act when they're hungry. So you've got a crying baby, we can't just, don't let the baby cry, just feed the baby. And if you've got to feed the baby in public, then let's feed the baby in public. And I think I'm happy that the mindset in some places is changing, but we definitely, like you said, we've definitely got to get more people on board, for
we
sure.
do.
Hmm. So you've got all these great ideas. I love it. I mean, I absolutely love it. I think that it's beautiful what you guys are doing in Mississippi. Do you guys plan to expand? I mean, now you've got Zoom, so do you guys plan to expand and maybe, take your cafe out of state, out of the country? You never know.
You never know. I never thought about that, but you never know. That's a great idea, because when we start receiving people throughout outside of Indonesia, and they were coming from like North Jackson and all far, far down other places, and I was wondering, hey, we're reaching all of Mississippi now, but I never thought about, will I reach another country? But it's worth thinking about.
Hmm.
Because there are moms who need that support, and it doesn't take away from the work that's already being done,
Hmm.
but it just adds to the work that's being done. And I think once we collectively see that we're all in this together to help the families that we serve, then we can it'll become normal, just as it is in those other countries. But
Hmm.
people have to be breastfeeding. There are times I take my little doll and I walk around. Well, before, I haven't done it since COVID, but I will hold her and walk in the store like I'm a nursing mom, just to get the expressions of people, because we can't change a culture if we don't see it.
Hmm.
We have to see it. Yeah.
Yeah, that's, ooh, I might need to do that. I might need to go get me a doll. just and just see what happens. But I think you're so right, and it's the little things that we have to kind of think of. People can't change what they aren't aware of. They may not even recognize that they already have biases in place with regards to breastfeeding moms, and so on and so forth. So I think that that's very important. Well, I mean, like I said, kudos to you in doing what you're doing. I think you should think of definitely taking this outside of Mississippi, because you never know who you're going to reach, right? You never know who
Mhm.
you're going to be able to bless, who you're going to be able to touch. And this information is universal, right? They're breastfeeding mamas everywhere. They're mamas who may need support. They just may not be in Indonesia, but they could be somewhere else in the world and stumble upon all the good work that you guys are doing. So I mean, keep at it, keep reaching people. Keep doing the great work that you're doing. Is there anything else that that you guys have in store that you guys want to share with regards to the baby cafe? Any links, any events, anything that we can support, anything that we can help get out there for you guys?
There's nothing that I can think of at this moment, but I guarantee when this call is over, I would definitely have a whole lot of things on my mind. But we do want to not only look at the baby cafe because we don't want people just we do want all breastfeeding moms to receive the support and education as well. But we also want it to be like a hub.
Hmm.
To say if a mom need clothing, if she need food, if she need diapers, whatever she needs, we want to be able to give that to them or be able to help them with those resources. So those are kind of like things that I think of. I don't of course I want all of everybody to be breastfeeding friendly, and that's the norm, it's
Hmm.
just normal. But I'm also cognizant of the fact that there are some other things in a mom's life that hinders or would keep her from breastfeeding. She won't breastfeed if she's worried about how her children are going to get their next pair of shoes, or
Hmm.
if she doesn't have food on the table, and things like that. So that's the way my mind goes as far as when it comes to expansion, looking out beyond what we see and making it, a resource or hub type place that moms can receive everything they need.
Hmm. And I forgot to ask you, just to kind of go back a little bit, you did say that you guys offer home visits. So are
Mhm.
you guys still doing that in lieu of the pandemic? Are you guys still reaching out to moms in the home?
Yes, one of the
Yeah.
things, because I do work with the Healthy Start program, and so they do home visitations, and it just has been a blessing that our parent educators were still able to go into homes and visit the moms and do what they do with their families, because they have not skipped a beat,
Hmm.
and no one has thankfully, no one has contracted the virus. They're still able to see their families and follow those social distant guidelines and things like that. So families are still being able to receive the care that they need, and as well as our educators are being protected as well.
Okay, and I wanted to highlight that too, and I'm glad that you said that because I think for a lot of individuals out there, they assume that because of the pandemic that all in-person services have been terminated, or at least to some extent, and they're still like, for example, your home service is still very much available. So if there are any moms who are listening, who are hearing this, who have friends or family members in the area in Indonesia, definitely make sure that they are aware that they can still have access. Is there a specific protocol that they need to go through to be able to access these services?
They can just reach out to the Delta Home visitation program. And I'm definitely going to have to give my number because I don't know the home visitation number. But they can reach me and we can get them connected to the proper people that they need to be connected to.
Hmm.
They can reach out to me at 662-378-6963 or Lambert at deltahealthalliance.org. And we can get them connected to the right people. We do serve moms who are pregnant, of course, pregnant to with children up until 18 months for the home visitation program. The baby cafe, all moms are welcome if
Hmm.
they're breastfeeding, or I have not even limited to if they're not, even if they're not breastfeeding, because some moms may want the education and support for the next go round.
Yeah.
So we try not to put limits on when it comes to the baby cafe, because we do want to make sure all of our families are receiving the support that they need as well to help them reach their goals. And one of their goals may be the next go round, or well, I wish I had this before. Well, now knowing that this is in place can help the next time.
Hmm. That's wonderful. That's really wonderful. And does the Baby Cafe have a website? Is there a way to sign up to join those sessions?
They can visit www.deltahealthalliance.org, and they can look under our programs and look under the Delta Breastfeeding Coalition site. And then
Mhm.
you will see everything about the Baby Cafe there.
Wonderful, wonderful. So we'll make sure that we have those in our footnotes. So when you guys are watching, you guys are tuning in, you guys are able to see that information. Again, if you are a breastfeeding mom, a mom to be, you're pregnant, you're planning a pregnancy, and you're in this area in Endonolia, Mississippi, make sure that you are reaching out to the Delta Health Alliance and you are checking out the Baby Cafe as well as their home visiting services. Those are going to be really, really awesome resources for you. Well, Miss Jacqueline, thank you so much for being a part of this. I mean, as always, as with all of our other guests, it's just amazing to sit and listen to you guys and chat with you guys about the great things that you guys are doing in and around your communities. And it definitely needs to be highlighted. They're not I'm like, how do people not know about all this amazing stuff? All right. So we want to make sure that people know. We want to make sure that people are aware that there's such great work going on in and around their areas. So thank you so much for being a part of this.
Thank you so much for having me.
Wonderful. Well, guys, that wraps up yet another episode of VIPs in Action. Join us again for our next one as we continue to interview these amazing birth workers, birth professionals who have been recipients of the Rose Breastfeeding Grant and are part of the VIPs in Action cohort, doing amazing things in and around their community. So until next time, take care.